Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, owner of Wells Legacy Health and Wellness, a full service primary care practice where we partner with you on your health. And our goal is to make sure that our family, our friends, and our community have the information that they need to create a legacy of good health. That's what it's all about. Health is wealth, as there's a saying goes, health is wealth. If you don't have good health, then it impacts every area of your life. And I just want to again say thank you all to each and every one of you who join each and every Wednesday for Wellness Wednesday, who share the lives, who join the live, who send the questions via DM. And for those of you who are referring patients to us, we are currently accepting Aetna, Cigna, Blue Cross Blue Shield, TRICARE, Humana, Medicare, and Medicaid. And there's some others that are coming. So if you are someone who wishes to utilize their insurance, please give us a call so that we can verify that we accept your insurance and make sure we get you scheduled. Also, if you're someone who does not have insurance and you want to get established as primary care, you have something going on, reach out to us. Some other amazing services coming. We are now offering men and women health when it comes to testosterone replacement and all things men and women health with peptides and things of that nature. So many things coming. I'm excited. Tonight, we're closing out Men's Health Month. As you know, June is Men's Health Month, as well as Men's Mental Health, and we've talked about that. But I want to spend some time tonight talking about a subject that not many people like to talk about, especially men. They don't like to talk about this topic, but it's something that we're going to discuss and something that's very important in their overall health. And it's important that we create a safe space for men when it comes to certain topics that are taboo or women. Let me just put this: women, we talk about pretty much everything. We get with our girls, we talk about some of the issues that we have, and depending on how close the relationship is, there's no hold bar. We talk about pretty much anything. And when it comes to men, they're not as open with certain things. And tonight we're going to be talking about men's sexual health, what every man needs to know. And we're going to talk about some myths versus some truths and just talk about it tonight. So if you know a man, or I'm sure we all know men, if you have someone in your family who's a male who is dealing with some issues or who just needs to know this information, there's a lot of misinformation out there. So tonight we're going to provide some clarity on a few things. And when I talk to my patients, this is one thing that I mention, even the younger ones, because we talk about sexual health. And again, there's a lot of information that's misunderstood, under discussed. It's even stigmatized about talking about certain things, but it's vital. It's a vital sign of the overall health. So if there's an issue in one area, as I mentioned, if we look at the whole person, the whole body, and if there's an issue in one area, there's something causing that issue, and we need to get to the bottom of it in order for that person to be whole and healthy overall. Physical, hormonal, and emotional can impact what's going on with someone's sexual health, men and women, but tonight we're focusing on the men. It's important that we have these conversations. It's important that we provide the information and that we correct any incorrect information that's out there. So this live is for every man, every partner, every provider who wants to inform and to empower their patients. And that's what it's all about tonight. And that's what these lives are about, is to inform you all and to empower you with the information that you need to be able to advocate for yourself and to have the knowledge that is necessary for you to make those healthcare decisions for you, your family, and your partners. So let's talk about it. What is normal sexual functioning, right? I can remember having a conversation with a young adult male, and he was just like, well, it just happens. Like, I don't think about it. It just happens. And there is a time and period in a male's life where they don't think about erection. It just happens, right? The wind blows. They just happen. It just happens. They, whatever the thoughts are, it just happens. But there comes a time in life when it doesn't happen. And there's a lot of emotion. There's a lot of psychological things that happen in a male's life when it doesn't just happen. And so there's different components to normal male sexual function, and it includes several key things. The first one is desire or libido, the desire to have sex, the libido. Some individuals have high libidos, some individuals have lower libidos, and it just depends on that person and their physical makeup and all the things, right? There's a lot of things that play into that. Then there's arousal, the ability to achieve and to maintain an erection. And then the other thing is orgasm or ejaculation. And other components of that is satisfaction, both physically and emotionally satisfied with the act of having sex, making love, what have you, or whatever you want to call it. It's important to know that normal varies depending on the individual and age. So we can't put a cookie cutter approach to it, or we can't put cookie cutter standards on normal male sexual function, because it varies based on that individual and their age, as well as if there's any other things going on with them medically. So a 25-year-old man and a 60-year-old man will not have the same sexual response. Some of them do. Some men who had a high sex drive at 25 still have high sex drives at 60. It just depends on that individual, and it's all individualized, and that's okay. What matters is consistency, comfort, and confidence in the experience of the actual sexual act with those men. And good sexual function depends on healthy blood flow. There has to be good blood flow to the area. Hormones, especially testosterone, which is considered the male hormone, nerve functioning, mental health, and relationship dynamics. So there's a lot that goes into it. And some people say men are from Venus. I think women are from Venus, men are from Mars, that women are more complex, when in actuality, we're all complex. And there's a lot that goes into having normal sexual functioning. And it's not just about the act of it. There's a lot that goes into it. And I think some individuals have this stigma about men that it's not emotional for them, but it is an emotional act. So what are some of the common sexual health issues in men? We're going to talk about a few of those, right? A few things that men face, and many of them are treatable. However, not a lot of men will have this conversation with their healthcare providers. There's a lot of shame. There's a lot of guilt. There's a lot of doubt. There's a lot of emotion that goes into this and having those conversations, and it prevents them from getting the help that they need that could be very treatable. And so one is erectile dysfunction, or ED. It's this difficulty in maintaining or getting or maintaining an erection. And so there are many men who suffer from that. It can be caused by one, stress, low testosterone levels, which is the hormone, vascular disease, if there is any, peripheral artery disease, anything going on with that individual's vascular system, it could cause a decreased blood flow to the penis. And so if we go back to anatomy and physiology, when a man gets an erection, blood flow is diverted to the penis to cause it to be engorged, and that's what causes the erection. And so if there's an issue with blood flow or vascular damage or any condition that's decreasing blood flow to that area, that man is not able to either achieve or sustain an erection, or the firmness of it is not the same. Certain medications, and this is where I can remember when I was in my RN program and I was doing my BSN, my project for my bachelor's degree was to discuss with men the implications of high blood pressure, some of the medications that they take on sexual health, and how it impacts. And so I had several men during that time talk to me about, I don't want to take this medicine because it's infecting, some parts. And I was like, well, yeah, but we got to get the blood pressure under control. So having those conversations, and then knowing that there are options for medications. So if one medication is causing certain symptoms, there are other medications that are used to treat blood pressure that won't necessarily cause those issues. But if we don't deal with the blood pressure, that's a vascular issue, and it could definitely cause some problems with erectile functioning. Diabetes is definitely one, because diabetes can impact the circulatory system and the vascular system. And I already mentioned high blood pressure, but these are some of the things that we need to know and men need to know. But it's often an early warning sign of cardiovascular disease. So individuals who are having erectile dysfunctioning, there's a high percentage of those individuals who are developing or will develop cardiovascular disease or cardiovascular issues later in life or at some point in their life. The second thing that I want to talk about is low libido, which is low sexual desire. It's more common than men want to admit. And it's not something that's openly talked about, because what man wants to admit that they don't have the desire to have sex? Not many men want to talk about that, but it does happen. It is common, and it impacts more men than we know. And some of the causes of that, of course, we got the hormonal imbalance, depression, sleep deprivation, and relationship stress. So all of these can lead to low libido. And individuals' libido can wax and wane throughout life, depending on where they are in their life, their age, what's going on in their family, within their family unit, with that individual, work stress. All those things can play an impact into that. And again, it is an emotional thing, right? And so if someone's emotions are all over the place and they're not there, they're stressed out, it's going to impact their libido. Premature ejaculation is sooner than desire. It's often tied to anxiety or past traumas. And there can be some other things that can cause premature ejaculation. And some of the things that can be utilized to help is behavioral therapy, and medication can help with this as well. There's another condition, it's called Peyronie's disease. And this is where there's an abnormal curvature or painful erection due to scar tissue within the penis. And so some men may notice, where they used to have a specific shape of their erection or their penis, they're noticing an abnormal curved or painful erection. And that's something that has to be taken care of medically, because it can be painful for those men. And it can cause issues with their confidence and performance when they have those issues. And one of the other issues I think that is more prevalent in society is infertility. I'm going to sidestep for just a moment. I had the privilege of joining a group of women at the Built to Last Women's Gathering this past Saturday. And we spoke about our stories about infertility, pregnancy, and infant loss. And we talked about infertility. And many times when we think about infertility, we think about the women, that women are having issues with infertility, but men also have issues with infertility. And so when you have a couple that's dealing with infertility, both individuals need to get checked out to find out what the issue is. And so if one partner gets checked out and it's not the woman, then we have to lend to, let's see what's going on with this man. And sometimes both parties are fine and we just don't know what the cause is, right? But it lends to the importance of going and getting those healthcare checks, right? So infertility, what does that mean? Low sperm count. There's a poor motility and abnormal shape of the sperm. And this can come from trauma. It can come from medications. There can be some genetic things going on there that could cause it. It can also be related to smoking, alcohol, medications, hormone levels, if they're not optimal, and then chronic illness. If these individuals have chronic illnesses that could impact their sperm count, the motility of it, or the shape of the sperm, which causes issues with infertility. And so having these honest conversations with your healthcare provider will open up avenues of getting additional care and treatment and diagnoses and screening to find out what is going on, especially if that individual is desiring to have children. If the partner is wanting to have kids and they've made that decision and they have not been successful, then there needs to be some conversation and some screening done. So we're going to talk about some myths. There's a lot of myths And there's some truths behind each one of those myths. And one of the most common myths is only older men deal with or get erectile dysfunctioning. And that could be so far from the truth. The truth is that erectile dysfunctioning can affect men as young as 30s and even younger if they have any of the things that I mentioned previously, any social issues, emotional problems going on, stress, you name it, chronic conditions. So as early as young as 30s, but sometimes even younger, depending on their medical history. Low libido means I'm not a real man. And that is not the case. Libido is affected by stress, as we mentioned, illness, hormones, and it's not related to an individual's masculinity. Another thing is testosterone supplements fix everything. That's not true. That's just one piece of the puzzle, one piece of the pie when it comes to that individual's health. It treats the root cause, but it's only one part of the issue. We need to look at that individual overall to make sure that their hormone levels are optimized, that their lab levels look good, that they're exercising, drinking, eating right, doing all the things. And when I say drinking, I mean drinking enough water. Let me correct that. And all the things to make sure that we are ensuring that these individuals are in optimal health. And then another myth is mental health does not affect sex. And it does. Depression, anxiety, past trauma absolutely do impact a man's sexual desire, libido, their drive, stamina, ability to achieve and sustain an erection. All of those things and some others can impact an individual's overall sex drive and ability to desire sex and things of that nature. And one other myth is my partner will think less of me if I talk about it. And in reality, your partner knows that there's something going on and wants to have those conversations. I've talked with women and I've dealt with many women who feel like it's them. You know, this is happening because he's not attracted to me. He's not, desiring me. And so the women begin to go in their head and think that they're the problem. And then it's just a snowball of things that happen. And in reality, most partners are relieved to have open and honest conversations with their partners about this because it's a together thing. You can't have sex with, well, we're not going to go there. But if you are in a relationship and you're desiring to have a healthy sex life, it takes two individuals who are willing to be raw and honest with each other and have these conversations, because if there are issues, it's impacting both individuals. And so we want to make sure that we are fostering healthy relationships and healthy marriages by talking about these things. Okay. So talk about it. Your partner is ready. They want to have those conversations with you. And when we talk about the actual structural and hormonal influences, sexual health is not just psychological. There's also the physical and the hormonal components that have to be considered. When we look at structure, we talked about the vascular disease. So there could be narrow blood vessels that will reduce blood flow to the penis. And I kind of talked about that a little earlier. There can be nerve damage, individuals who have diabetes, individuals who've had previous back injuries and back surgeries, or certain surgeries that could impact the nerve endings in that area can cause issues with erectile dysfunctioning. It can cause issues with sensation in the area. It can cause issues with so many different things. And so we have to be able to know that full history, which is why it's so important to get those physical exams every year. It's so important to make sure you get your prostate checks if you are within age to have that checked out. It's so important to make sure that your A1C is good, the one that we look for, that 6 months, 90-day, look back of your blood sugars that gives us the average. Make sure that your blood pressure is good, that your cholesterol levels are good, because if any of those are off, or if you're dealing with a chronic condition, it can impact your physical health. and your sexual health. Another part of that is prostate problems. So surgeries of the prostate for prostate cancer or prostate enlargement can affect sexual health and sexual functioning. So it's so important that we follow the guidelines and the recommendations for health screenings. When we are talking about hormonal imbalance, when we talk about hormonal imbalance for men, the first thing that comes to mind is testosterone. But we also look at estrogen and all the other hormones in men as well, right? Because we all have, men and women have the same hormones. They're just higher. Testosterone just is typically higher in men than it is in women. And estrogen and progesterone is higher in women than it is men. So there's a delicate balance there to figure out what's going on. And so signs of low testosterone include fatigue, mood changes, memory issues. Individuals are not able to remember things, of course, low libido, and then reduced muscle mass. As men and women age, our hormone levels begin to drop, and that's just a natural occurrence. And so as men age, those hormone levels will begin to drop. So keeping a close eye on that, especially if an individual is having issues already and some structural issues are going on, or they've started to gradually have issues with maintaining an erection and it's not as firm as it used to be over time, or it's not lasting as long as it used to, then we need to look at the hormone levels as well as other things. But remember, the testosterone level is only a part of the puzzle and can be caused by aging, as I mentioned, obesity. There was a study recently that was released in one of the nursing journals about obesity and men losing weight and the impact that it has on their sexual health. The numbers are astounding, and the outcomes are really good. So a lot of men, when we're having those conversations with men about obesity, that's one of the selling points for me to talk to these men about. That is, for every pound that they lose, there's a increase in a certain area. And so we're seeing that happen, especially with the uptick of the use of GLP-1s and the weight loss medications. And then, of course, some certain medications could have impacts on that as well. And again, there's always options, right? There's always options to medications. And so if you are on a medication and you weren't having any issues before you started that medicine, and then all of a sudden you're having some issues, have a conversation with your healthcare provider. Talk to them about the issues. And anytime you're given a new medication, talk to your healthcare provider or the pharmacist about the side effects of the medication. What are the potential side effects? And I'm going to tell you, every medication may have a million side effects. It doesn't mean that that individual is going to get or experience those side effects. Anytime a medication is being they're studying the medication, or it's in the research phase, anything that an individual experiences while they're on that medication is documented as a potential side effect. And so I have people come to me, well, I don't want to take a medicine because I'm looking at all these side effects. Well, it doesn't necessarily mean that you're going to have those side effects, right? And we have to weigh the risks versus benefits. If your blood pressure is 200 over 190, and we're asking you to take some medication, and you don't want to take the medication because of the side effects of you having a stroke are going to far outweigh you taking medication to decrease it, right? Now, if there's potential that you have an anaphylaxis, if you've had a previous allergy to this medication, of course, we're not going to give you that one medication. We're going to find something else that's comparable that you don't have an allergy to. And then, of course, chronic illness. I'm going to get off my soapbox, right? Because those are conversations I have with patients, family members, and friends alike. Treatments include lifestyle changes. So lifestyle changes, weight loss, exercising, as you know, 50 minutes of 30 minutes of moderate intensity exercise, 5 minutes a day, and weightlifting as we're aging. We have to be mindful of that because we have these online clinics that pop up, and you're able to just put in a few answers to a survey and you get medication shipped to your home. And not everybody is honest on those surveys. And so you have to be honest with yourself and your healthcare provider, because those individuals are putting their license on the line to provide you with medication, and you're not telling them the whole truth. And so if you end up in the hospital, with adverse effects because you weren't honest. And not everybody's like that. We've had some cases that have happened that I know about, but just make sure that you are taking your health into consideration when you are wanting to start certain medication. Some tips: blood work. What are your levels looking like? Are there anything that's abnormal? Is there something that we can work on in terms of decreasing the saturated fats that you're eating to decrease your cholesterol levels? Is the A1C elevated? Can we do something to reduce that? There's a lot that we can look at with the blood work. Is the testosterone levels low? Can we replace that and put you on testosterone replacement therapy? Sleep patterns. How are you sleeping? Are you not getting enough sleep? Are you not resting well? Or if you are sleeping, are you getting up at night to urinate 5 and 6 times because you have prostate issues? These are things we need to talk about and know. Is your weight, your body weight, playing into this in your hormonal health? So it's important to look at that whole patient and determine what's going on with them. When it comes to the psychological side effects of sexual health, your brain is just as important as your body when it comes to sex. If your mind isn't in it and you're somewhere else, you're not going to perform as well as you'd like to. And you might not have a good experience. Performance anxiety can cause or worsen erectile dysfunction. So if a man is already dealing with erectile dysfunction and they get in their head about the act, they're not going to be able to fulfill the act because they're in their head, and anxiety is going to cause it to worsen, or it's going to cause that individual to suffer from erectile dysfunction because they're too much in their head, because the last time it didn't, happen the way that I thought it would. Depression often lowers libido. Individuals who are depressed, they don't have a desire to do much of anything. And so when you're going to your healthcare provider and you're having that full physical exam, they should be asking you 2 questions on the PHQ-2. Have you felt down, hopeless, or depressed? Lack of interest in doing things that you normally enjoy doing, or to some degree. And based on the answers of those questions, you may have to have a full PHQ-9, which is a more intense depression screening. And then some others may be added in there if you're having anxiety and things of that nature. So when we look at relationship issues, trauma, shame around sex can affect function. A partner's response to previous, inabilities to attain or sustain a erection. And so that's where we have to make sure that we're creating safe spaces within relationships. So if one person is having an issue, they shouldn't be made to feel bad about that, right? But we have to be able to meet each other in the middle and find common ground on what needs to happen. There are many individuals who are in relationships and marriages who the partner does suffer from erectile dysfunction. There's different things that can be done in terms of medication, and there's alternatives that can be done, right? There's a lot of open space there for pleasure and satisfaction when it comes to sexual health. I'm not going to go too in depth about it. You guys can use your imagination and figure that out and have those conversations. But there should not be shame around or guilt or individuals being made to feel bad about sexual dysfunction. And then pornography addiction can alter expectations and impact real life intimacy. I can recall having a patient who was addicted to pornography, and he was having issues in his relationship, and primarily sexually, because he had unrealistic expectations because he was watching pornography. And that does alter expectations. These people are on camera and they're putting on a show or what have you, and you're trying to make your partner be this person that you've seen in this show. I want to encourage you guys to, especially primarily men, and that's what we're talking about tonight. I want to encourage you all to address mental health and not feel shamed about it. There's therapy, there's support groups, there's powerful tools. And it's not a sign of weakness, as I mentioned before. We've talked about mental health this month, men's mental health, and reaching out for help is not a sign of weakness. I know I'm going a little bit over tonight, but I feel that it's warranted. So hang in there with me. We're almost at the end. When it comes to chronic disease and sexual health, sexual dysfunction is often the first symptom of a chronic disease. And I talked about that earlier. Sexual dysfunction in ED is a precursor in many situations of cardiovascular issues. And so diabetes damages the nerves and the blood vessels. We talked about that. Hypertension reduces circulation to the penis, which decreases the blood flow. Obesity lowers testosterone levels and it increases the estrogen levels. And when there's an imbalance, then the desire, the ability to, or libido is lessened. Sleep apnea, poor rest disrupts hormone cycles. So individuals who have sleep apnea can have imbalances in their testosterone and other hormones such as estrogen and progesterone levels. And then heart disease. ED often shows up 2 to 3 years after heart symptoms. So an individual who has erectile dysfunction, it often shows up 2 to 3 years before they begin to have heart issues. And so if someone is experiencing ED, it is so important that they are checked out and monitored by a cardiologist or by their healthcare provider yearly with a detailed heart exam, the EKG, what have you, and make sure that they are not developing a major cardiac issue, and that it's not gone noticed and it's going unnoticed. I want to encourage, again, routine care, getting those physical exams, being proactive about your health, not just reactive or crisis management. We don't want to react when there's a crisis. We want to make sure that we're being proactive about it. It's so important, especially as men age, to make sure that they're staying on top of their health care. And some signs and symptoms that we need to know about and some of the treatment options. So when should you know when to seek help? When do you seek help, men? When you're having difficulty getting or keeping an erection, if there's certain sudden loss of libido, if there's extreme fatigue, depression, or irritability, if you have those painful erections, or if they're curved and it just doesn't, the shape of it does not look like your normal, because every man is different, just like every woman is different. Changes in your testicular size or firmness. Fertility concerns. You and your partner have been together and you've been having unprotected sex for a certain period of time and she hasn't gotten pregnant. It lends to potential fertility issues and it needs to be looked into. So what are some of the treatment options? So when we look at medically, what can be done for ED, medications such as Viagra or Cialis, testosterone therapy, we've seen an increase in that over the past few years. And that's something that is a service that we offer here at Wells Legacy Health and Wellness. We want to make sure that we are providing for the whole person, and it includes sexual health as well. And then there's some injections, there's some vacuum devices that can be utilized. There's penile implants. There's so many different things that there are many options now, shall I say. When we come to therapeutic treatment options, counseling for stress, anxiety, trauma, couples therapy, being able to talk with someone to work through the dynamics that may be causing stress or tension in the relationship that could be impacting sexual functioning, sexual health. And then lifestyle, we talked about it, weight loss, exercise, sleeping, not sleeping enough, not getting full rest at night, waking up throughout the night, things of that nature. And then smoking. So if you're an individual who smokes or you're drinking, those are things that we need to look at and maybe eliminate some of those things. And then if there's Peyronie's disease or severe ED caused by scar tissue or lack of blood circulation or blood flow to that area, surgical procedures can be done. So if an individual is having issues with blood flow or circulation, there's certain procedures that need to be done because that's coming from a circulatory issue and it's impacting their ability to achieve and sustain an erection. The key is early action. Don't wait until it affects your relationship, self-esteem, or overall health. And I've talked to some women who are dealing with sexual issues in their relationship, and the partner does not want to get help. They refuse to believe that they're having a problem, and overall it's impacting the relationship in general. Sexual health is health. It's not a luxury. It's not shameful. It's a vital sign of your body and your mind. Just like your blood pressure is a vital sign, just like your heart rate is a vital sign. It tells us, it kind of gives us a gauge of how healthy you are. And so if you're noticing changes, don't ignore them. See your provider. Have the hard conversations with yourself, your healthcare provider, and your partner. You are not alone. There's so many different men. There's so many men who are dealing with the same thing. And if men were as open with women, you know that you're not the only one dealing with it, right? But there's certain things people don't talk about because they, are private individuals. I get that. But you have to talk about it in order to get help. There is help available. There's definitely help available for you. If you're in the Central Florida area, Wells Legacy Health and Wellness is here to support your journey to better sexual, hormonal, and mental health. Give us a call or message us to schedule your confidential consultation today. We are here to make sure that you have everything that you need to leave a legacy of good health. And that starts with your sexual health. I want to say thank you all so much tonight for being here with me. I know this is something that's kind of all that I usually don't go into detail about, but it's important. It's definitely important. It's something that needs to be talked about, and that there's a safe space, as I mentioned, for men to be able to talk about it and have someone that they feel comfortable having these conversations with. So thank you all so much for taking time to listen to this live. And women, I know you probably listen to it like, oh man, this is not for me. It is for you. If you have a man in your life, if you know someone, share this information. If you have to go to the appointments with them, see if they're open to having you come to the appointment with them. And take care of yourself, men. Do what you need to do. Be proactive about your health and take care of yourself. This is Dr. Latoya Wells again with Wells Legacy Health and Wellness. I just want to say stay safe and be well. And until next time, we will see you again. Take care of you holistically. Make sure you're doing what you can do to leave a legacy of good health. Bye.